Welcome. It's Monday motivation across the nation. This is the perfect way for you to start your week. We are digging in today into quick facts. Actually, we'll be doing it. This has been such a transformation for us as we've been reading through the material. We're really studying in real time and we're making good progress on the most important parts of the process, which is just doing the work. We can't get the results if we don't do the work. So this is Monday motivation. Hi there. If it's your first time joining me, my name is Professor Regina Callion. It's my pleasure to be on this journey with you. I'm a registered nurse. I've been a nurse since I have been 16 years old. 16 years old. My first nursing job, taking care of my grandparents, in our home. Many of you might have a story similar to mine, but that is when I made the decision, accepted the calling to provide care for people that I love. So today we will be talking about appendicitis. Is coming right out of Quick Facts, page 8. Get it ready, get it ready. As we are thinking about passing NCLEX, you know it's a huge investment, not only in time, but also in financial means. It costs money to prepare for NCLEX. Anybody who says, oh, they're just going to prepare for NCLEX for free, not possible. Number one, you had to go to nursing school in order to be able to sit for NCLEX. Expensive. Nursing school, expensive. So you invested then in nursing school. You invested in your scrubs. You invested in that stethoscope. You invested in those shoes, right? And so when it comes to your licensure examination, it is also an important place to invest because you only want to take NCLEX once. By golly, this is an exam you don't want to have to take several times. So with ReMar, because I'm so confident that you will pass using the V2 program that comes with Quick Facts, it's pass NCLEX or get your money back. That is what we are standing by. It's something you don't see too often. But right now, we believe that that is the case. So you pass NCLEX, you get your money back. Let's dive into today's study session. I don't want to keep you waiting any longer. I know, I see where you're from. I see you're ready to go. You guys are on time. Sometimes you're even waiting for me. I can even tell who's waiting for me for class to start. So get out Quick Facts. We are diving into it today. We're talking about appendicitis, and appendicitis is found in probably all of the curriculum. So whether you are in NCLEX, the V2, whether you are in nursing school V2 or T's and Hesse V2, all of my courses are available to you, and appendicitis is important for all of them. So open up, let's dive into page number 8. Appendicitis, very common. I am not going to belabor you with things you already know about this condition. We are taking it from the critical thinking standpoint. And this is the information that I went over with my international nurses in Africa. I had some that were from the Philippines that were on, but it's the review that I do in Africa. They also have appendicitis as a common condition. So when we talk about appendicitis, right, studying begins now. Okay, appendicitis is an inflammation, right? It's an inflammation of what organ? And I know you all are saying, Professor Regina, it's an inflammation of the appendix. Perfect. But what type of organ is the appendix? What actually is going to be inflamed? What is the function of the appendix? Today I'm asking you things that you may not have been asked before, but you do need to know. So the function of the appendix, pretty much two things, right? We know that the appendix is attached to the colon. So it's a digestive organ. It also has lymph function. So it's an immune organ as well. So think about what happens, even though you don't need it to survive, think about how it's helpful to you. And with this structure being inflamed, what that means for the patient. So digestive and lymph organ. Now, the first thing that I bring attention to is the what age range, and I'm on page 8 of Quick Facts. It may be different from yours, but it's page 8 for me, right after anorexia. What age range is most affected with this condition? Look at it here. Age range 10 to 30. Now that's really interesting because we're talking about who here? We're talking about children, we're talking about teens, we're talking about young adults. Now, most of the conditions that we are studying for NCLEX, like, we're studying Alzheimer's, we're studying COPD, we're studying diabetes mellitus type 2. These are things that are seen in the stroke. These are things that are seen in older adults, or even the elderly. But appendicitis is a young person's condition. Did you pick that up? Now I want to ask you, why is appendicitis seen mostly in younger people? What's up with that? What's up with that? Why is it? What's different about the appendix? What's different about the appendix? Actually, what I find so interesting is that our appendix has different activity levels. So in younger people, this accessory organ is working much harder, meaning that it has more chances of becoming inflamed. It also has a smaller lumen inside of it that can get obstructed more easily. So the organ is smaller, the lumen is smaller, and it's easy to become obstructed in children and in teenagers and young adults. I think that's so interesting for us to know and remember that, because anytime you have a 10-year-old, 11-year-old reporting stomach pain, sometimes it's easy. And look, I'm a mom of 4. Isn't it easy for parents, your kid is complaining of a stomach pain, to be like, oh, you probably ate too much junk food, or go sit down somewhere, or stop drinking so much soda? But no, it could actually be appendicitis. So if your preteen comes in and they're saying their stomach hurts, you better start. What's the question you're going to ask, right? What's the question that you as the nurse need to ask? Or even if you're working in the ER, a patient comes in with a stomach pain, we got to ask, where is it? Tell me what you know about it, right? Very important for us. So, one of the most common signs of appendicitis here is you have that right lower quadrant pain. Right lower quadrant pain. And this is very interesting because it is a classic sign of appendicitis. What I want to note is that typically that right lower quadrant pain does not start there. It typically starts around the belly button. Okay, so it typically starts around the belly button and then it progresses to the right lower quadrant. The reason why it starts at the belly button is because when you're first born, you have your umbilical cord and it's cut off, right? So the same nerves that innervate that umbilical cord is the same nerves that the appendix use. So when they cut your belly button or your umbilical cord, those nerves, they go away for the umbilical cord. You don't need them. But the appendix is still like, hey, I need these nerves. So when it becomes inflamed, your body senses, oh, this is the umbilical area. And that's where people start to have pain first, right? So let's look at the other signs and symptoms. What I like about the appendix section in Quick Facts is that it's very short, but it's filled with a lot of information. So the next is, well, what are the other signs of appendicitis? Because yes, we're going to have right lower quadrant pain, definitely. But also the patient is going to have nausea and vomiting. Nausea and vomiting. All right. Loss of appetite. Why is that something that we actually want this patient to have? What is the benefit? And it's so interesting. I love how we are created. I love how God made our bodies. If a patient gets appendicitis, the nausea and vomiting actually helps them. And I know we want to take it away, right? Because we don't want the patient to be uncomfortable, but it serves a purpose. What is the purpose of a patient with appendicitis having nausea and vomiting? What does that do for the patient? Those are the questions that make you to be a great nurse, right? I don't want you to just be memorizing things. I want you to be able to explain connections. So when it comes to exactly the nausea and vomiting helps the patient not want to do what? They don't want to eat. They don't want to eat. And so this is great because if you're not eating, then the stomach is decompressing. And then also your appendix is not working to do digestion. So this is a good thing, right? And that's the purpose of nausea and vomiting. We don't want this patient to eat. I also have here a low grade temperature. Why is the temperature low grade? Appendicitis is very serious. Why isn't this a high grade fever? Does it mean it's not serious? If it's not a high grade fever? Why is the body only producing a low grade fever? Correct answer. Correct answer. Put it in the comments. This is how you show up for class. This is how you show up. So the correct answer here is because where is that inflammation? Is it systemic right now or is it contained to one part? Exactly. It's just contained to one spot, which is the appendix. So all of that inflammation is being captured in the appendix and it's in there like a stuffed sausage, right? Everything is all in that one thing. So that's why right now that fever is low grade. And we know that the ability for the appendix to rupture is a real issue. And it's a serious complication of appendicitis. So I do want to move into that. When I talk about let's go to the treatment of appendicitis. The treatment. So what I have here is immediate surgery to remove the appendix. And I asked this question yesterday, is this pre-rupture or post-rupture for the appendix? If we're talking about removing the appendix, are we doing this before it ruptures or after it ruptures? What do you say? What do you say? This is good. And these are things that maybe we didn't think about. And two, I also want you to just do a temperature check on how you feel when you're studying. Are you excited? Are you happy? Does this feel fun? Because this is how it should feel when you're preparing for NCLEX, right? You're a nurse. This is your stuff. You love this stuff. And so studying for NCLEX should not be a grievous, tedious process. It actually should be kind of scary to you because you're like, I like this. This is good, right? So we're talking about pre-rupture, that you can't remove a ruptured appendix, right? You are going to be doing something different. Your mentality is different. Before it ruptures, it's just like, okay, we're going to take this appendix out. So pre-rupture is the answer for this treatment. Now let's think about post-rupture. After the appendix has ruptured, what is now the focus? What's the focus? What has spilled out of the patient? How do you fix this? Right? So after the appendix ruptures, now sorry, getting communications. After the appendix has ruptured, now the focus is not spreading infection, right? Not creating a peritonitis situation, because you have everything that was in that appendix now spread out all into the patient's abdomen, right? So the lymph fluid, the digestion, the bacteria, all that stuff is now spread out into your patient. So after the rupture, the surgery now is on keeping the contents of that ruptured appendix contained. So we're going to try to suction it out as much as possible. Let me also draw your attention to, I feel like you understand IV antibiotics, right? Let me draw your attention to Semi-Fowler's position, because Semi-Fowler's position also serves a specific purpose: pre-rupture and post-rupture. And NCLEX may approach you on this thought. So we are doing Semi-Fowler's position before the patient has a ruptured appendix. Why? What is the purpose of semi-Fowler's position before the appendix ruptures? The purpose is to help reduce what? Pain. It's to help reduce pain. It's to help the patient breathe, right, easily. If the appendix ruptures, we still want to keep the patient in that sitting up semi-Fowler's position. Maybe even half Fowler's, but it's definitely going to be semi for sure. The reason why is because once the appendix ruptures, we want to be able to contain the contents of the appendix right in that area. And so sitting the patient up will do that. If you lay the patient flat, like imagine the patient's laid flat, then that infection and all type of particles from the appendix can rise up into the body, which we don't want. Okay. And then the last point that I just want to go over today is heat. Heat is so stressed when it comes to appendicitis care. Are we doing heat? Is heat a good thing or a bad thing? Are we doing heat for appendicitis? What do you say? The correct answer that I want you to say is what? Is heat good or bad? Absolutely. Heat is not good. Heat is bad. Why is heat bad? Why is heat bad? Heat is bad because it actually increases circulation to an area. When we put heat on a patient, it will actually, yes, cause rupturing to happen even quicker. It speeds up inflammation, right? It speeds up inflammation. And so even for myself, I'm pretty sure that I fractured my leg, working out, and it hurts when I walk on it. But me as a busy person, I been pushing through for like 2 weeks. I just been pushing through. I've been working out and all these things. And I've been putting ice on my leg, like ice. Then I got this stuff from Thailand. I don't know if you guys heard of it before, but Tiger Balm. I don't have it with me, but I've been putting this Tiger Balm on my leg too, right? And it's helping me with the pain. But when I take, if I put hot water on my leg for any reason, like a shower or bath or anything like that, it just aches so badly. It just aches so badly. So draws heat draws blood to an area, and it's not good for appendicitis, like at all. So that's one thing that of course you need to know. The rest of it, the clinical priorities are there. My main goal for us today was to discover kind of why appendicitis is considered a pediatric condition. If you didn't pick that up while you were reading it, also knowing the pre-rupture and post-rupture nursing priorities is something that can also be pinpointed out for NCLEX. So good job reading today. This has been Reading Quick Facts with the author on today. Now, as part of Monday Motivation, we got to get into our word. We got to think about it, consider it. And this is so good because God sees your fear. Fear is something that a lot of us struggle with in general. And no matter who we are, as individuals, I know that you may have a fear of something. There is something that is just like, whew, I don't want this to happen. Maybe it has not happened yet, but you certainly don't want it to ever happen. And through our daily lives, we can encounter and give way to our fears. And God does not want us to do that. So when you scroll through social media, there may even be some news that shocks or scares you, and definitely looking at the news, no matter what country I'm in, there is always a news station that is saying there are so many reasons for you to be afraid. Calamities, crimes, wars. I know people, they say, we want to come to America, but we're scared to come to America because of the crimes in America. And to me, because I grew up here in America, number one, I know where to go and where not to go, right? I just know where to be at. I go to work and I go home and I go to nice tourist friendly areas in America, right? You will not catch me in back alleys. You will not catch me in bad neighborhoods. I just don't go to those places because I am a very conscious individual. But when people say that from other countries, I tend to think about my experience in their country as a foreigner. And I'm like, I never seen officers standing on the corner. They don't do this in America. But you have officers standing on the corner with long guns, like literally like rifles with these long things on them, ready to go. I mean, they're just standing there. And I'm like, oh, I remember the first time I was in Kingston, Jamaica. That was the first time I saw that. And then I'm like, man, this place is bad. They got officers on the corner. And then I went to Asia and I was in the Philippines and I saw it and I said, man, this place is scary. And then I went to Kenya and I'm like, man, in Africa, this place is crazy because the officers are there. But at the same time, I'm like, maybe I should feel safer because these officers are here. So I think there's so many reasons. I say all that to just say that if you're looking for something to be afraid of, you will find it. You will find it. And people will help you to be afraid too. But what does the word of God say? The word of God says this. In 2 Timothy 1 verses 7, it says, for the spirit God gave us does not make us timid, but gives us power, love, and self-discipline. And for me, this is so good as a reminder of what does not come from God. It does not come from God. Fear does not come from God. He does not give you fear. He does not give you that, that timidness where you are afraid to step out or be brave. But what does God give us? God gives us the confidence. Look, he gives us power. He gives us power. Do you know what that means? That means the advantage over what's in front of you. He gives us love. And we know that love conquers all. And also this one right here, I'm claiming it. He gives us self-discipline. Self-discipline. Because some of your problems would be eliminated if you had more self-control. And there is not some mysterious enemy that is, preventing you from accomplishing your goals. It's actually you yourself. Like, ma'am, the call is coming from inside the house. Like, your issues are self-sabotage. And so it's good to know that he gives us the power to deal with those things. So that in your life, nobody is more deserving of the success, of the great things happening than you. And you have to claim it. You have to claim it because there's so many things that want to steal that away from you. So it goes on to say, my takeaways, fear, it can be paralyzing and it can prevent us from stepping out on faith, from taking risks, and from standing firm. And there's something about, I've been listening to this song. I don't know if you have heard it before, but it's just firm foundation. Like, Christ is my firm foundation, the rock on which I stand. Because difficult times, they come. And if you don't have your house built on solid rock, you will sway, you will fall, and it will be a very hard time for you to um you know to make it. It will be really hard for you to make it if you don't have a firm foundation. So fear, if we're given away to fear, it will do that to us. But fear is not from God, because God's spirit brings peace, not panic. And fear may be loud. It may be very loud, but God's word is eternal and it's louder. It's louder. So what will you be building this week on? Is it fear or is it faith? Is it fear or is it faith? I know that with God's grace, every day that we have, we can receive our daily bread, and we can be grateful for the most precious gift that we have this week. If you don't know what it is, it's time. It is time. And if you have time, you can do and you can be so much, so much. So don't limit yourself and don't allow fear to take over. Great study session. Monday motivation has been served. Was my favorite part of Monday motivation today was you showing up, because sometimes when I do this class, I don't know if you're going to show up or not. And it's okay if I'm just doing it by myself. That's cool. I've been doing this for 15 years, right? But it always is nice when you show up and decide that you're going to make studying with me part of your Monday. So God bless you all. I'll be back on Wednesday. Let's prep for Wednesday. For Wednesday, I want you to read arterial blood gas. Arterial blood gas. This is good. I'm going to be taking it from Quick Facts, but also don't forget arterial blood gas is also in the V2 program. Okay. So in the V2 program, we actually go into the interpretations of arterial blood gas. It's on page 63. So I'll probably end up watching this video because I did positions, but then I still need to do disaster management, herbal medications, and then I can do blood gas interpretation. So let's do it. Let's make a commitment to do it before Wednesday. Follow on the study calendar. We'll get it done, and we'll talk about ABGs on Wednesday night, Winning Wednesday, 9 p.m. Eastern Standard Time. Let's get into it. All right, so we'll get off here. We'll go into the V2. You know how I do. You know how I do. And as always, you can, you will, and you must pass NCLEX. See you later. Bye-bye.